Here we have the cervical pattern test that we look at both flexion and extension of the cervical spine, rotation, and lateral flexion. Now these motions will be described in your manual, and it should be equally distributed throughout the cervical spine. So I'm not going to go in depth here. It's good to look at many different clients or individuals and see what you see, and I'm going to point out a few compensations that do happen. All right, Cassie's going to go ahead and flex her chin to her chest, and that's usually the command. And come back up and go ahead and look to the ceiling. Very good. So normal motion is we're going to look for a nice curve in the upper cervical spine and the lower cervical spine to make flexion happen, and usually, ideally, on an axis, on an axis of rotation, going through about the center of the cervical spine. And then extension, same thing. We want to have the pivot point through the center of the spine. There's actually two vertical axes through the ears in the center of the spine. We're just going to look for that the head and the neck evolve around that vertical axis, or that axis of rotation. Compensation in flexion, you may see, is if you ask the person to bring their chin to your chest, they'll actually jump forward and come down. Now you can see that, and I'll have you come up, Kath, I don't want you to be there for too long, but that is a shear force of the neck. The neck and the head come forward and then rotate around, so it deviates from that ideal axis of rotation. Go ahead and do that again for me. There you go, and back up. So again, a lot of pressure in the lower cervical spine and a shear effect. And that's a balance or imbalance of muscular imbalance there. It becomes a little bit more technical when we're dealing with cervical spine, but the manual should walk us through a little bit of that, things to look for. Now as you extend, oftentimes that's a good motion. The compensation would be where you'd ask them to extend, and they actually just extend the upper cervical spine. So again, there's a shear forward and an extension. Again, creating some excessive stress in the neck. Probably pain potentially would be the outcome. And what you can always do is, if there is either pain on flexion or extension, is just have them centrate and try to give them the cues of that axis of rotation and see if it makes the discomfort better or the motion improves. So that's just kind of a secondary test that we prove whether that is a movement pattern problem. So lateral flexion, we'll have you face here, Cassie, and you're going to laterally bend your head to the right shoulder and then to the left. There you go. We're looking for a nice curve in the cervical spine. All the way through, and go ahead to your right again. Perfect. So a nice C curve here, and what I call, to the left side, a reverse C curve. So again, here's the axis of rotation, okay, on the sagittal axis actually, and you want to have a nice pivot point. Compensation can happen where we laterally flex, and you actually see they go into a rotatory motion to make up the difference. All right, and then go to the other side, so there will be rotation. That is that's a dominant effect of, say, the levator scapula, or the upper trapeze, just taking over for the rotatory muscles in the cervical spine. So again, those intrinsic muscles are being compensated by the extrinsic muscles, the bigger muscles. So that's a point of lack of stability in the cervical spine. You also may see when rotation happens that you come down through and rotate to the chin to the chest. So the lateral flexion and rotation does intermingle with each other. So if we were evaluating rotation, we want to have it on the transverse axis, the vertical axis down through, and pivot. The compensation is very similar. Again, they can extend back or tilt forward. So we want pure motion in those cervical spine movements without any deviation into the other planes of movement. There is some mechanical things to look at that the manual may briefly mention about coupling action of the cervical spine, but we don't want to see gross movements. If we're going to flex, if we're going to rotate, it's on a vertical axis, transverse axis. If we're going to laterally flex, it's on the sagittal plane axis in a nice pure plane. And again, flexion and extension comes on a frontal plane axis around there. We don't want to have any deviations of the hip. So a quick brief look at cervical spine motion. Look for asymmetries for range of motion. Look for pain or any compensatory movements. And usually you'll find that we can work on the tonic facet muscles to balance that out, and then followed up by proper movement patterns.